healthcare. You will find that this your healthcare now, it has become now delivering quality care, quality patient care. That is the whole of this healthcare. Healthcare has now become an industry. If you see in 80s, that time we used to talk about IT. That time there was an IT revolution. Now in 2000, we are talking about all. This is a healthcare and healthcare revolution. That is happening. Now, major part of this your healthcare, you will find that at that time actually there is a huge gap in terms of number of beds and patient. As per the WHO, World Health Organization's study actually, they could find that is instead of having one bed into 3 patients, we are below, actually below 1. So there is a huge amount of infrastructural gap you will find. Now to compensate that infrastructural gap, you will find that the hospital is growing like anything, particularly private sector. Why this private sector growing? Because the government has got their limitations, and 70% of the healthcare hospitals beds being dominated by private care. Because government, though we understand that.
And I was not prepared for it, but anyway, I thought that I would get a memento and come back. But I have to talk something. And really, I feel honored, and at the same time, feel humbled as well, because I don't expect so much of applause from the students whom I have not taught, but I have got many appreciation for the students I have taught. As you can guess, come to know that I am one of the senior-most persons in the profession today. I am now 90. So I have seen healthcare.
Dr. Pradip Mitra.
Oh yes, I'm sorry. I got so many appreciation from students like you, not over in Calcutta, in India, but all over the world. So naturally, I feel that is my greatest achievement. I have earned many achievements, many orders, but I think one of the greatest achievements that I have earned in my life is the appreciation from my students, not patients, but students as well. And that is what I feel happy today. I feel full today that I have been applauded by the student. Now, what I have seen over the last 60 years, 5 decades, I think, the gradual change in the attitude of healthcare, not only in India but all over the world. Say when I was very young, say graduating in the year 1950s, at that time the healthcare was more aggressive than what it is today. And we talk now more sophisticated or more discriminatory, meaning thereby in that time, in those days,
over the years, over 17 years or so, 2002 we started, people called us mad because we started with mechanical engineering and electrical engineering, and not only computer science and IT, as was the design of the day in those years, but then gradually, right today, we have a couple of engineering colleges. One, sir, is in this campus, Shonarpur. It's called Future Institute of Engineering and Management. And the second, because we couldn't cater to all disciplines of engineering like civil and others, we have another campus near Goria Metro. There we have Future Institute of Technology. Apart from engineering, we have several management courses, and also in new disciplines of media, hospital management, and others we have stepped in, and today is by the vertical Future School of Hospital Management. A couple of years back, we were pained to see that the perception of West Bengal in healthcare, much as we hate it, when we go outside the state, even if I have an eye operation in the state of West Bengal, I was told, আপনার কি মাথা খারাপ? আপনি পশ্চিমবঙ্গের বাইরে যান, post-operative care অনেক ভালো পাবেন. So again we felt the same pain that we had felt in 2001, and we thought time has come, we must step into healthcare. Brainstorming, and now we have in the horizon Future Oncology Hospital. It is a 220-bed hospital coming up. It will have all kinds of treatment, including nuclear medicine. It's very close from this area. It's near Kamalgaji, and we hope that beginning of 2019 we would step in. Right now we have a chain of diagnostics by the brand name Future Diagnostics. All along these 17 years, In fact, we have schools. We have a school and another school is coming up. All our ventures have the name Future. We have resisted in bringing in GPS, in taking a franchise of Apollo, in doing certain things which were roads easier traveled. We have chosen the difficult road to travel to keep the Team Future flag flying high in education and healthcare. Ladies and gentlemen, this is a non-profit trust. We do not intend taking out a single penny, but to plow back, and the trust will function. We will not be there. In fact, both my husband and myself, he quit Pricewaterhouse. He's not here right now. And I quit IIM Kolkata. I was teaching finance there. We quit our jobs to set this up. We would not be there. Long life to our Doyle. But I don't know how I don't know whether I look it, but I'm approaching 60. I wish I don't look it. And so even if we are not there, the trust, the activities will remain. And let us hope that this will keep a few footprints in the state of West Bengal, if not beyond. Thank you so much. And
Get it? Thank you.
the theme of this year's festival, which is Goodbye Depression and There's Hope, right? And we'll probably focus a large part of our discussion to the youth today, if the panelists agree. I would prefer that it is an interactive session, and I would like the mic to roam around for any questions under the sun, because it's not every day that we get experts together. However, the panelists would address this issue of depression to begin with, and thereafter the mic is going to go around. I'll put forward a few basic questions. The word depression, in fact, right from the keynote today, if some of you were here on the dais, is sadness depression? Well, I've broken up from my boyfriend or my girlfriend, is that depression? If there's a grief, I've lost somebody, is that depression? So what is depression? Are we prone to depression? Is depression, can it be measured? Like, for example, the blood pressure or the blood sugar, or is it subjective? If it is subjective, when somebody tells me, I have depression, am I similar to Deepika Padukone? Okay? So I think if we kind of focus on these few issues for the next 25 minutes or so, which means each of the panelists get about 7 minutes time, and then we focus on questions. Let us begin with Dr. Ranjan Ram.
Thank you for inviting me. Thank you, Professor Roy, for inviting me and kind of giving me this opportunity to talk about this. I have been here before. I had loved the interaction earlier, and so I came back. And also he promised that he will take me out for an evening of drinking and alcohol, so I hope he hasn't forgotten that. So we'll hold him to that. So I must thank the Future Group, Motion and also Mrs. Motion Ghosh for organizing this.
Because I told him I was approaching 60. Okay, fine.
No, if I had known that I would be sitting between three attractive women, I should have taken more care. The other reason also I came because if I don't come, then my sister would call me up the next evening and kind of chastise me because they are very close friends. So I had to come. See, the topic is Goodbye Depression, and the questions which I think we will have an interactive session. Depression is part of life, isn't it? So can we really say goodbye depression? No. Like happiness is. So can we say happiness goodbye, sadness goodbye, depression goodbye? I think first and foremost, we have to learn the fact that sadness, anger, misery, joy, cheerfulness.
I'll start with basically, why I'm here is because I've been into teaching for, all 27 years of my work life. So I always prefer standing while talking. That's the reason I didn't start there, I came here. As Dr. Ghosh was asking, all sadness is not depression. That's the first thing which we have to keep in mind. Anxiety, tension, sadness, everything is not depression. Point one. Depression is when we sustain that sadness or that anxiety, stress, whatever we call it, for a long period of time, and also when our functionality gets impaired. So something is different. We are feeling sad, but along with our sadness, we are doing everything. So that's not depression. When our functionality gets impaired, it's then that we start getting bothered about it. Till before that, we are really not much bothered about it. And also, as Dr. Depression, you are aware of depression.
And to add to that, today I'm sharing the panel with the veterans of the fraternity. In fact, Suvarna has been my mentor and my teacher at one point. So I feel there is very little that I can add to what they have said, but I will only try to affirm what they are trying to say here. This program is for you, about you. It's about the students mostly, if I'm not wrong, Dr. Roy. And since morning, a lot has been told to you about what you should do to be a better professional, to give it back to the people in the healthcare system, which is very important. So you got a lot of valuable advice. But what I was wondering is, as a psychologist, it will always be important for me that if you are not well, you cannot do any well to anyone else, like Suvarna was also saying. So it is very important that you take care of yourself so that you can give it back to them and you can do some good to them and you can make some changes that is expected of you. Depression, Suvarna and Dr. Ram, they explained a lot about depression, about the symptoms, about the coping mechanisms. Depression that we are experiencing, that has changed phases. Like mental health issues are always a problem because we don't see it. We can't touch it, we don't see it, we don't hear it, we only feel it within ourselves. So sometimes a mental health problem can be like a wound which is not bleeding, which is only bleeding inside. I'm hurting but I can't see, so no one is probably taking as much care as it requires. And that disguise has even become more and more pertinent right now. Like what Suvarna was saying again, that we only try to take a step when our functionality is getting hampered. On the contrary, many of us has experienced depression at several levels when we are being functional, we are going to our workplace, we are doing things, we are eating, we are meeting people also probably as required, but something is not feeling right. So I would like to ask you to raise your hands if you have ever felt that everything is fine, I'm doing everything, no one can tell that something is bothering me inside, but something doesn't seem right and I don't know what. Have you ever felt that? Anyone? I have. Well, let me tell you, it is okay to feel that. It is okay to feel that feeling. But the important thing is, what do we do about it? Like the chronic and the acute. So when you feel it for a short period of time, it can be acute. So you address it, you take care of it, and you get over it. So the acute condition is over, just like having an infection. So we go to the doctor, we see the doctor, they give us medications, we get over it. But there are certain things when not taken care of can turn into a chronic situation. Since you are all young, I will try to point, I would actually like to hear more from you because it will be meaningless.
Yeah, I think that's